All right, so I started recording here. So we will send you the recording. So for future reference, if you want to watch a webinar, but you can't make it at that time, just register and you'll get the recording. If you have any questions, send them into the webinar and I'll answer them at the end for you. And other than that, we'll get started. So today we're talking about celebrity Medicare ads. We'll talk about who's pitching them, what they're really saying. They're very well done, the ads. We'll talk about that more, but it's they put some time into staying compliant with those, but just barely. We'll talk about how it impacts clients and prospects and the way to handle that with existing clients. Okay, so who does the commercials? Well, there's a bunch of groups that do them, but Health Markets is one. Health Markets tends to do the Mike Ditka one. You don't see that one as much. It's not as popular. They do some others as well, but that's the one they do. The popular one you see the most is the Together Health. They own the Medicare coverage helpline. They do the Joe Namath commercials. So that's a company called Together Health. They own the Medicare coverage helpline. That's the number of people call into on the commercial. And they are owned then by Health Insurance Innovations. That, some of you, that might ring a bell for some of you. That's a big company. They're on the NASDAQ, and that's who owns them. These commercials are pretty clever because people think they're CMS, and especially the Medicare coverage helpline. It sounds a lot like CMS, so it was pretty smart and pretty well done how they did it. It is CMS compliant, but it definitely, does seem to be part of CMS. So it's not to be confused it's not to be confused with the Medicare helpline, which that's another online broker owned by Tiburon. So there's a bunch of lines: the Medicare coverage helpline, the Medicare helpline. They all sound like Medicare. They're not. They're all private brokers, and brokers out there that are selling. So most of these agencies are set up as telesales agencies. So for those not familiar, anybody really could do a telesales setup. However, there are a number of requirements to do so. We have programs for that, by the way. It is a bit involved, I will tell you. So if you want to do telesales, you can, but there's requirements. You need some key employees. You need a minimum of 5 telemarketers, full-time telemarketers. And most of the carriers will require 500 apps per year or they'll terminate the deal. But we certainly know how to do that, know how to set people up. If anybody's interested, we can talk to you about the requirements for it. But this is mostly, when you see these commercials, they're almost all telesales agencies doing them. They're all selling, so the telesales agencies, and they're all pretty much selling dual eligible plans. So most of these companies are set up, so they'll sell a regular MAPD if they need to, but they're really what they're pitching on the commercial are dual plans. So, and we'll talk about that in a minute, but they're pitching dual plans and they're pitching and relying a bit on people who are eligible to be either in the Medicare savings program or dual eligible. They are usually, surprisingly, not set up to sell supplements. They don't even try. The way they do things, most of them, I'm speaking a bit broadly here, but the way most of them do it is, since they have a quota they have to meet for each company, they are just selling one company at a time. So maybe they're meeting Aetna's dual quota. Once they meet it, whatever their number is they've set, then they move on to the next company. So you'll notice a trend. Like the Joe Namath commercial earlier in the year when people were calling in, they were selling nothing but Aetna duals. Then they moved on to WellCare, then United. They just do it company by company. So it's interesting how they do it, but they're just doing that so they can meet their quotas, so they can continue to operate as a telesales agency, and they more than meet their quotas. The numbers they set are, I think, pretty large, pretty large numbers. So let's see. So I see some questions coming in. I will definitely answer those for you at the end. So what are they saying to people on the commercial? Well, the commercials are almost entirely pitching extra benefits such as dental, vision, hearing, rides, transportation, and OTC. Those are the things that they're pitching on the commercial. The reason they're doing that is they've got a lot of research. Studies definitely show that extra benefits have now become one of the top priorities for seniors looking at Medicare plans. Now, we can argue all day long that shouldn't be a top priority for people, but the reality it is. So They know that. They know that's a hot button for a lot of people, and that's what they're pitching on the commercials on TV. Oops. Okay, so what are they saying to people? Well, all the statements they're making, first of all, are within the CMS guidelines. This hasn't stopped in the past groups from, challenging them for being misleading. However, when you really look at the guidelines for CMS and what you can and can't say, they are meeting them. They certainly don't elaborate on many things at all. They leave a lot of things out of the equation, but they're hitting the speaking points that they need to hit to stay compliant. They do only mention what's required. If you notice, they won't go into detail. They don't mention any negatives, but you're not required to talk about negatives. So it's very clever how it's done. It's very smart. It's right on the edge, but it definitely gets people's attention. Like, for example, I put in there no mention of benefit limitations. So they don't mention anything about, you might be eligible for dental benefits. Well, they don't say, yeah, but limited to $1,000 or $1,500. They don't mention that the Part B reduction is only for duals, people on MSP or people who are dual eligible, or maybe it's a Part B reduction plan in a state that has a Part B give back, but not all states have that. They don't mention those things. They also, if you notice the trend, they really downplay that they're even talking about a Medicare Advantage plan. They might mention it once or twice, but they're really not pushing it. And the thing you got to keep in mind here is most people watching the commercials, they don't understand the difference. I mean, that's the key thing. I forget what the statistic was, but it's a high percentage of people that are aging into Medicare. They don't truly understand the difference between original Medicare and a supplement and a Medicare Advantage plan. So when they're watching these commercials, they're really mixing and blurring their understanding of what this is. Do most of them even know the difference? Not really. They're kind of getting the impression that these are benefits being offered by Medicare when in fact they aren't. So we'll talk about how it impacts clients and prospects. Like I said before, the majority of people on Medicare, a larger majority aging in, even in today's day and age with everything you can access online, it's still confusing. They don't understand, so they really don't get it. They see this commercial and think this is a benefit Medicare is offering. Now, when they get on the phone with these agencies, they're reading all the disclaimers they need to read, certainly, but the people definitely, most of them don't have a full understanding of what they're doing. So they're focusing on the things that commercials intend for them to focus on. So, people focus on the parts of the commercial that say like no cost. Joe says that a lot. Benefits you deserve, you see that a lot. And they're always talking about dental, vision, hearing, rides, OTC. Your average consumer doesn't know that they're talking about, well, if you're a dual eligible, or if you're eligible for a QMB on a dual eligible Medicare Advantage plan, or in some cases a Medicare Advantage plan with some of those benefits. But people also don't know the limitations on these benefits either. I mean, I was told, I saw that, they'll pay for all my dental and all my vision. They say all my dental and my vision will pay for hearing. You're watching the commercials and getting the impression that all these things will be paid for. This has definitely had a major impact on Medicare beneficiaries. These commercials run endlessly. They definitely have kind of trained people to focus on ancillary benefits instead of the actual medical and drug benefits, which you could argue, which I think most people would argue are more important. People are being trained now to really care about dental, vision, and hearing and other benefits like that. The other thing, those of you who have big books of business may have noticed, is it leads to a lot of people on Medicare supplements wanting to go to Advantage plans. Because think about it, they watch the commercial. Oh my goodness, I could be getting all these things. Why am I not getting it? So they'll see the commercial. They might look it up and say, oh, it's an Advantage plan. They really don't understand the difference. They only know the positives of Advantage. And they'll call you and say, I want one of those plans where I can get dental, vision, and all those types of things. This might even come from people who are high utilizers of medical care. Even the situation where maybe they'd be way better off staying on a supplement because they utilize so much care, but they just don't understand Because if you notice in the commercials, they don't talk about co-pays for medical services and out-of-pocket maxes and those types of things. So you get somebody coming to you who is very sick, but they're dead set on having an Advantage plan now because they saw the commercial. It can cause a problem, especially in your underwritten states. I did put a slide, a bullet there at the bottom. You know, in underwritten states, if these people are unhealthy, they switch to an Advantage plan. After their 1-year trial right ends, they're staying in an Advantage plan in most states. Obviously, there's a few states, New York, Connecticut, Massachusetts, and Maine, they're guaranteed issue at all times. It's not quite as dangerous for them because they always have the right, regardless of health, to switch back. There's a couple states like Oregon and California with the birthday rule. Other than that, though, after they've been on an Advantage plan for the first time for a year, their trial right expires. Once that trial right expires, they're on an Advantage plan. So that can be dangerous in some cases. So that kind of gets us to the point here of how to handle this with new and existing clients. Well, because of the commercials, more people will want to know about the benefits that are being pitched. We get it with our agents in our office all the time. The best way to do that is explain some of the benefits, explain to them that some of these benefits are only for duals. You know, people on Medicaid, they'll understand that term. People on Medicaid are people with low income, so some of these benefits are only for them. Mr. Smith, you know, you make $80,000 a year or $50,000 a year, you certainly wouldn't qualify for that. That will help in some cases, explain it to them. And then you really got to explain Advantage plans in simple terms. So I always talk to our agents and even for myself, and I've learned from others that, you know, when they call asking about an Advantage plan, you've got to have a quick, concise, and very understandable way to explain it. And usually the best way to do that is say, yeah, okay, that's called a Medicare Advantage plan that you saw on TV. Let me explain how it works briefly, and you give them the positives and negatives of that. So, you know, you can give them the positives, mentioning, yes, it has all these extra benefits you saw on TV, 0 premium, drug plans included. But you also got to tell them about the other side of it. You know, these are network-based plans. You're not on original Medicare anymore. You're still paying your Part B premium in most cases, unless you're a dual or on a buyback plan. But these are network-based plans. There's limits on how much extra benefits they're going to pay. Also, what they don't mention in the commercial is you're going to have co-pays for all your medical services. In some states, that could be a $6,700 out-of-pocket max, even higher in others. So you really got to explain the positives and negatives in a brief, understandable manner so they get it quickly. Then the other thing that we'd like to do is explain the positives and negatives of a Medicare supplement. So we'll explain to them, well, you may be on a supplement now, or the difference is on your plan, you're on original Medicare. That's what doctors and hospitals and the providers bill first is original Medicare. Your plan has no network. You go anywhere you want, anybody who participates with original Medicare. If you're on a plan G or F, you basically have full medical coverage. You also have no prior authorization for things like MRIs, CAT scans, injections, that kind of thing. Negative, then you talk about the negatives. The negatives are you pay 3 premiums. And these supplements aren't going to have all these extra benefits we're talking about. They're going to give you more access to care, and they're going to cover you better on the real benefits that matter the most, but they're not going to have as many of these extras that you're seeing. So your explanation's got to be quick and simple, because you really have to remember who you're explaining this to. You're explaining it to an audience usually that doesn't understand. I wrote in there, then, don't fight a losing battle. I think I learned this from experience and learned it from listening and talking to other agents as well. It's certainly important when they call like this to give them an understanding of the difference between Advantage and supplement and what they're seeing on TV. But at the end of the day, and I'll stress this one, at the end of the day, if they say, hey, I don't care, I want one of those plans, if you've talked to them about the positives and negatives, they're the customer. You should enroll them in one of those plans. Some agents now will say to me, well, that makes me nervous. You know, this person's really sick. They should be on an Advantage plan. You can certainly do your best to explain the difference to them and why you feel maybe a supplement works best for them. But at the end of the day, again, they're the customer, and really you should do what they want. If you don't, so let's say you really strong arm them and say, well, no, you need to stay on a supplement. You shouldn't go on an Advantage plan. trust me, when anything goes wrong or when they're paying their 3 premiums, they're always going to blame you for it, or they will most times. I know that from experience. So really, when it comes down to it, if your job is to explain to them what the differences are between the plans, do your due diligence. If you put them on an advantage, check doctors and drugs, but it's not your job to talk them out of something. It's your job to educate them and make them understand what they're getting into. I kind of lost my point there earlier, but some brokers will say, well, that makes me nervous. I mean, certainly if you want, you can create an extra document, or some of the enrollment kits or our online enrollment portals, some of the documentation has a form where they can have a checklist and check off things saying, yes, I understand. Some agents make their own document. They put it in the file just saying, yes, I know I'm going on an advantage plan. That's going to become my primary insurance. I pay copays. They have them check that off and sign it. A little harder to do with the online enrollments, Connect for Medicare and with Sunfire. Some of those forms won't be available, but you could always email it to them if you wanted, or you could just send them an email and have them reply that they understand, if that kind of thing makes you nervous. So what I'm saying is let them decide, unless they specifically say to you, what do you think? What plan should I take? Just a suggestion there. Everybody does things a little bit different, but that's definitely what I've seen that works the best. So the other thing is, does the area you sell in determine if, I know this point here, I hear a lot of agents say, well, I'm in such and such a state and this is a supplement state, or I'm in this county and this is just an advantage county. Well, that's only part of the story, because I can tell you, I have multiple agents sometimes in the same area, same county, working with the same prospect base. One broker will say to me, this is, we almost only sell advantage plans here. The other broker will say, well, no, this is pretty much all supplements here. Like I said, that's only part of it, the area you're in. A lot of it, whether you know it or not, has to do with your pitch and how you're influencing people. So you do influence them. I think that's proven out by, like I said, having 2 brokers in the same area and they're selling different things. So a lot of this is how you're pitching, how you're influencing, and what you're saying to them. So to summarize, the commercials may seem misleading, and maybe they are, but the reality is they are compliant for now anyway, unless CMS steps in. The one thing, this is good and bad, it does put more pressure on us to contact all our existing clients prior to AEP. Maybe in the past, people didn't know what was out there, but I can tell you, if you got existing clients now with all these commercials running and you're not staying in touch with them, you're going to start losing some of them from the commercials. Whether we like that or not, that's the reality. I threw in there a reminder about a quick note about OEP. I get this a lot. Agents will say, Ed, you're not allowed to use the OEP to sell plans, but the Joe Namath plan is running endlessly during OEP. It is running endlessly during OEP because they're not talking about OEP. If you notice commercials, they make no mention of it, and that's the rule. You can't use OEP as a sales strategy or as an advertisement, but you certainly can still pitch plans all you want during OEP. You just can't use the OEP as a reason. So that's why they're able to do that. That's why you can do it as well. So at the end of the day, this will lead to more MAPD sales for you. You'll get some people that usually wouldn't have taken a Medicare Advantage that might be open to it now. But it does cut into our prospect pool as well. You definitely will get some people that maybe in the past that's somebody you get a hold of and you write. Now maybe they see a commercial and they just call and go through the telesales agency online. It's a reality we live in. I think there's some good and bad with it. But like I said, I just wanted to go over some of the points of it. And that's it. I ran a little longer than I had wanted to. I'll check for questions in 1 second. Like I said, we're doing our webinar tomorrow on MAPD dental plans and standalone dentals, getting into the details of benefits, balance billing, that kind of thing. Let's see if we have any questions. On this topic, I would think we do. Yeah, we have a bunch. Okay, so I'll read the question and then I'll try to provide an answer. I thought selling extra benefits was prohibited by CMS. It isn't. You can talk about extra benefits now. And if you notice, they keep saying extra benefits that may be available to you. So they're not saying they are, they're saying they may. And what they're really it's a fine line here. When they say that, are they talking about extra benefits available through Medicaid or drug help, or are they talking about the extra benefits on the Advantage plan? Hard to tell, but that's a good question, and yes, they are compliant in doing that. You can do it as well. Next question is, I missed the first few slides. Where do we download slides? I will send out a recording of the webinar to everybody that registered, so you'll be fine there. Next question, can we as agents complain to Medicare about the misleading statements? That's a really good question that has been done a lot. It's been done a lot, and that's the difference. The statements, they're accurate. People are interpreting them in a way, I mean, they're doing it just right. They're saying everything they need to say. They're not elaborating at all, but they're not required to. So for now, yeah, they can do it. And agents have complained, government agencies have complained, but right now they are following CMS guidelines to a T. They're just leaving out all the details. Now, whether you think that is, kind of underhanded or not, yeah, that's debatable, to an extent, I think it is, but they're within the rules to do it. Do you know if these agents compare prescription costs between carriers, and do they check network doctors? So, good question. When somebody calls in to a telesales agency, they do not compare drugs between plans. Remember, they're trying to fill a quota, so they're pitching a plan. So what they will do is, if they're filling somebody, whatever company you pick, that quota, that's the plan they're selling for them, they will check the drugs and see if the drugs are in the formulary of the plan, and they will check the doctors, but they are not comparing that to other plans. Really good question, by the way. Couple more questions. Would it be a good idea to develop a Medicare, let's see, let me read this. I had a couple more questions that came in. So, would it be a good idea to develop a Medicare compliant education PowerPoint, MAPD versus MedSup? There isn't one I know of. We do have something similar to that. That is a webinar. If you email myself, edward@cronassociates.com, or lisa@cronassociates.com, or teal, like the color, TEAL, @cronassociates.com, we can send you what we have. We don't have something that is specifically dead on with that, but it's pretty close. But you just gave me a really good idea for a future webinar. Thank you. And we will do that in the near future. Do I use the same link for all net webinars? Good question. No, a new link is sent out for each webinar that we do. So we will email that out. So this is GoToWebinar, so it's a new link every time. Let's see, we just got a couple more questions here. These are really good questions, by the way. A couple more questions here. This year we saw ads saying Medicare will pay you $140 a month. I assume they're implying if someone moved from a sub to an Advantage, they'd see about that much in premium savings. Is there another area where they're actually able to say Medicare will pay them roughly $140 a month? Okay, so there's two things. Number one, they're kind of skirting the line here between, keep in mind, if you qualify for Medicaid, you no longer pay the $148 a month. So they're kind of talking about that, because if somebody qualifies for Medicaid or drug help, they don't pay the Part B premium any longer. The other thing they're kind of talking about is Medicare Advantage plans. In a number of states, there are Part B reimbursement plans that will reimburse up to the full premium. Now, in a lot of states, it's less. Maybe it's $50 a month or $60. But some states have MAPD plans that will reimburse the whole thing. So that's what they're talking about. Let's see, I had a client who called in and they didn't even check for doctors, facilities, or drugs, just enrolled her. Okay, yeah, I'm sure that probably does happen. Keep in mind, these agencies are big. They're writing a lot of apps and they hire a lot of new people. And I think we'd be foolish to think that they all know what they're doing. So yeah, that's definitely a negative. It's something to talk to clients about. You're dealing with a person who is getting paid hourly and really doesn't know or care. So it's a good speaking point to make. Can you send me the link for tomorrow? I don't think I got that. Yes, we will do that. We will send you the link for tomorrow. Make sure we email that out to you. And I'll just pull your email off of the registration list for this webinar. Those are really good questions. I think I hit all of them. Yeah, so that's it for the questions. If you have any more, feel free to give us a call or email us. Our contact information is at the bottom there. But hopefully today's session was helpful. I just hear this come up a lot, so I wanted to talk about it for a little bit and try to put a little context and perspective to it. but it's not all negative. There certainly are some positives here that you can use to help you with your business as well. So I appreciate everybody coming on today. I think we'll end the webinar now, and I will definitely send out that link for the webinar for tomorrow. Thanks, everybody. Have a great day. Please call us or email us if you have any questions.